A team of experts from the World Health Organization has arrived in China to investigate the origins of the coronavirus. The international team arrived in Wuhan, the city where the first cases of the virus were detected in late 2019. The team will spend around a month in the country, including a 2-week quarantine that began immediately. The WHO has clarified it is not looking to apportion blame for the spread of the virus. Joining me for more is Victor Gao. He's from the Center for China and Globalization, a think tank close to the Chinese Communist Party. Victor Gao, welcome. Good to have you back on the program.
Thank you for having me.
Mr. Gao, how committed is the Chinese government to ensuring the WHO team are able to carry out their work fully?
I think China as a whole, the Chinese government and the Chinese people are fully committed to working closely with the WHO team of scientists to study and analyze what happened in Wuhan in December 2019 and what exactly is the origin of this virus. This is very important. I think the Chinese people want to know the truth. Mankind want to know the truth.
Speaking about knowing the truth, the WHO team are there to determine, as you correctly point out, the origins of this virus. But there has been lots of media reports, particularly, and also government people who've been saying in China that the virus did not originate here. There have been suggestions that it originated in Italy, that it was imported through food packaging, that it was imported through the United States or the US Army. What would you say to that? Is that an attempt by China to muddy the waters?
No, I don't think so. I think several things are very, very important and can be verified. First of all, in December 2019, Wuhan discovered lots of people got sick and they did their scientific research and eventually they concluded it is caused by a new virus, subsequently named as the COVID-19 virus. And on January the 23rd, 2020, the whole city of Wuhan, with a population of 12 million people, was completely locked down. Now, the fact that China discovered this virus in Wuhan in December 2019 should not be interpreted as if the virus itself originated in Wuhan. Why? Because subsequently we have heard a lot of scientific research done by different countries, including very recently in Spain, saying that they discovered this virus as early as in November 2019. So I think the WHO scientific investigation should study all these different pieces of information to make sure that they do get to the real origin of the virus.
I think I just need to point out here.
By scientific method.
I'm sorry to interrupt. I think I need to point out here that the WHO itself has said that all of these claims are highly speculative. Let me just quote what the WHO's emergency chief, Mike Ryan, had to say. He said, "It's highly speculative for us to say that the disease did not emerge in China." The WHO doesn't agree with you.
No, I don't think so. I think the scientific investigation should be done in a scientific way. They should not artificially include or exclude any material pieces of information. And these scientific investigations and the reports were not done by China. It was done by Spanish scientists, Italian scientists, Japanese scientists, French scientists. I think they all deserve the attention of the WHO rather than being dismissed as if it is China muddling the water. I don't think China wants to muddle the water. China wants to see the real truth, the real origin of the virus.
You speak about scientific evidence, Victor Gao, but then I'm giving you the words of a scientific person, a senior functionary of the WHO, Mike Ryan, who's saying that whatever you're saying essentially is highly speculative. So you talk about scientific proof on the one hand, yet you disregard what a scientific person is saying.
No, I don't think so. I think the remarks you quoted just now were made before the discovery of many subsequent scientific findings, including the report I mentioned published in Italy very recently, I think just within the past 30 days or so. And I think WHO and its leading scientists should really include everything in a material sense in their scope of investigation, rather than, for example, jumping the gun and come to the conclusion that the origin of the virus was in China, disregarding all the material pieces of information probably proving the otherwise.
Right. You spoke about the discovery of the virus in Wuhan, and you gave a timeline from December till the 23rd of January when Wuhan, the epicenter, was essentially placed in a lockdown. But let's look at December. It is as early as the 1st of December that a scientific journal, The Lancet, has been saying that symptoms were observed in Wuhan. And after that, you've had Chinese doctors such as Dr. Li Wenliang who were warning authorities that something strange is happening here. Yet those warnings appear not to have been taken on board, and you have more than a month, nearly 2 months in fact, from the 1st of December till the 23rd of January when serious action begins to be taken. Did China miss these early warnings?
Well, a couple of things. First of all, let me talk about Dr. Li Wenliang, who is hailed as a national hero in China.
Right.
And he actually really raised the red flag, but he was not epidemic scientist. He was an eye doctor. He called the alarm for SARS. As we know now, it's not SARS, it's COVID-19. So I think Dr. Li Wenliang had all the good intentions, but he actually raised the red flag for another particular epidemic problem rather than COVID-19.
He said the words he used. I'm sorry to interrupt, sir. I think it needs to. I'm sorry to interrupt, sir, but it needs to be made clear that he didn't just say SARS. He said SARS coronavirus. And before Dr. Li Wenliang, there were other doctors who talked about a mysterious pneumonia-like virus. And going back to Dr. Li Wenliang, he also talked about bacteria that was being found in the throats, in the aerial cavities of patients. All of that, if you look at the evidence, points to a new kind of coronavirus, does it not?
No, I read the Chinese original text that Li Wenliang sent out to his colleagues in Wuhan. He used the SARS in Chinese, 非典, referring to that particular disease or epidemic phenomenon as SARS. Now, that in itself may or may not be very material now that we know this COVID-19 is spreading throughout the world. But in December 2019, it mattered a lot because what happened in Wuhan, as we now fully understand, is a new species of virus. It is not SARS per se. So confusing the two should not be done on the spot. I think Dr. Li Wenliang, should have alerted the government agency to really do a thorough investigation into the real origin of the problem.
But he did, and he was reprimanded for it.
No, he sent WeChat messages to his colleagues, alerting them that there is SARS breaking out in Wuhan.
So Li Wenliang made a mistake?
It is not SARS. He actually raised the red flag about a phenomenon for which he used SARS, and we know for sure now it is not SARS.
So you're saying your national hero didn't warn well enough that there was something new that was happening in China?
No, I don't think we have enough time to go into details during your interview. However, I'm very, very emphatic in the point that Dr. Li Wenliang did the right thing to raise the red flag. But he raised the flag for SARS rather than this new species of COVID-19 pandemic virus. There is a fine distinction, but the distinction is very, very important. I think mankind, even of today, do not fully understand the true nature of this virus. We still need to be humbled and learn more about the virus in order to save more people. No one should take it for granted that China was fully prepared to know everything about the COVID-19 virus
Victor Gao,
back in December 2019.
We're running out of time, but thank you so much for joining us with your views. Thank you so much.